In 1995, they cut the figure nearly in half and have gone 6 consecutive weeks without a reportable incident. Employees report that the incentive provided by the employer has been key to their performance. Price Pritchett and Ron Pound, in their book, A Survival Guide to the Stress of Organizational Change, provide 15 mistakes that can be made in dealing with a changing work environment. The first is expecting someone else to control your stress. We must create a workforce at all levels which is capable of dealing with the effects of change. To do so requires an investment in training as well as the enhancement of employee involvement. In 1974, Nyalho Mesarovich and Edward Pestel published Mankind at the Turning Point, and in it described a world in a state of transition, of evolution in grand proportions. They recognized over 20 years ago that people and organizations would be faced with changes, some at crisis levels in such arenas as the environment, availability of food, and population growth in general. In their global modeling project, they reference a development of a systems approach to resolving global crises. This is good advice, for we are all faced with globalization, or at least a restructuring of the parochialism we all once knew. As they say, the emerging world system requires a holistic view, that is, one that looks at all parts of a problem, as everything depends on everything else. Their models, although advanced, can be brought down to the organizational level. Such an example is shown in their total systems approach. What they show on a global scale, and what can be used at the organizational level, is the analysis and inclusion of all aspects of organizational existence. In the absence of looking at all elements, Mesarovich and Pestel suggest we are being unfair to the future. Their models, which again are more than 20 years old, have stood the test of time. Multiple texts have been written on the subject of change, including globalization, transnational economies, and cultural meshing. What is consistent are the recommendations to look at the big picture when determining approaches to deal with problems, as opposed to only looking at components. As employers, educators, and governments deal with change and handle specific problems, especially those surrounding productivity and output, hindrances will be best managed by analyzing all facets of society which can have an impact on your human resources. Although we are interested in managing large-scale issues, let's look at some important pieces to be knowledgeable of and to manage in our quest to manage productivity and enhance the health of human resources. Health, often thought of as an absence of disease, can be expanded in our discussion today to include an absence of the risk factors that lead to injury or illness. Of course, this includes physical and mental health. As I noted at the outset of the video conference, health may come in degrees, and part of what we are trying to accomplish is the maximization of health for its altruistic value, as well as its value in improving productivity. A larger and larger portion of gross national products are the result of service-related jobs, and therefore can be used as a barometer for managing the health of a workforce. Service industries are human resources intensive. Due to this intensity, exposure to injury and illness increases. However, the nature of such injuries and illnesses change when compared to manufacturing, agricultural, or construction-related economies. In a manufacturing or processing environment, health outcomes tended to be from acute injury sources, such as from interactions with heavy machines and tools. Now, with most employees, especially those in the U.S. employed in the service sector, we are seeing dramatic increases in injuries, such as cumulative trauma disorders and mental stress reactions. Much of the problem, as I related to injury and illness development, stems from not only the pace of work, such as sitting and putting data in a computer, that is, repetition, but they also are the result of a lack of worker control over a job. Many of you listening today are working in organizations where change is coming or is already there. As the old ways of accomplishing tasks die, so do most of their health outcomes. It is critical to predict and plan for the types of injury and illnesses you will be faced with as modernization strikes, as they certainly will impact the health of your human resources and thus your productivity. Changes in injury and illness exposure mandate changes must come as well in their management. For example, Traditional top-down control of ergonomic and stress risk factors and stress hazards tend not to be as effective as attempts at involving all levels of employees in the management process. Why is this? Several reasons come to mind and have been documented. Dr. Barbara Silverstein, a recognized expert on the control of cumulative trauma disorders, cautions against excluding those affected by ergonomic risk factors from groups trying to resolve the problems. Her case in point reflects engineering controls being established without worker input, which effectively die on the vine. This is as a result of not only neglecting to solicit human resource involvement, but in many cases the engineering controls simply do not work or result in the development of other problems. Most often those being affected have a very strong and practical feel for how to control exposures, and their input should have been solicited. There are contingent benefits to utilizing the workers actually exposed to hazards in control strategy development. These include a heightened sense of importance by the employees being consulted. Training and education on management and supervisory techniques takes place, and practical and often cost-effective controls are established. There are several critical outcomes to manage as the nature of work continues to change. At the turn of the century in the U.S., there was a major shift from agrarian economic base to one of manufacturing. The manufacturing base then shifted to one of a technical backdrop. Now, we are seeing the technical environment blend with the information age. If we know these transitions are going to exist, then as employers, educators, and government representatives, we should be able to project the types of injuries and illnesses which are going to occur. Using the U.S. as a point of reference, we have seen a 180-degree turn in injury and illness manifestation in just 25 years. When the United States major health and safety legislation, the Occupational Health and Safety Administration, was born in 1970, 80% of all injuries and illnesses were the result of unsafe conditions. The shifting economic and employment base has seen that statistic change dramatically, to where in the early 90s, nearly 87% of all injuries and illnesses are the result of unsafe acts. From a human resources point of view, these statistics are important. We have the tools, technologies, and resources to project the types of injuries and illnesses which are likely to occur. With that knowledge, strategies to impact trends can be established. What trends are likely to see in the near future? My feeling is that they will be concentrated in three areas, those being simple musculoskeletal injuries, cumulative trauma injuries, and finally reactions due to a lack of control over jobs, which includes psychological stress. Success in managing these outcomes has now been mixed. There are objective steps that can be taken by employers, government, and educators in controlling the development of these outcomes. Let's quickly take a look at some of those. Comply with regulations pertaining to the health and safety of human resources. In the event that improvements to legislation are necessary, employers and business representatives should engage themselves in the standard setting process. By doing so, real-world business dynamics are built into standards and are not simply engineered or textbook resolutions. Employers should perform studies which analyze the production elements of a task or tasks. That is, equipment, material, the people performing the task, as well as the processes themselves need to be reviewed. These reviews can and should take place for existing operations, but more importantly, should take place when operations are going to change, even slightly. The advantages to this approach is that the factors which may allow opportunities for injury and illness to develop can be identified and controlled. One of the most important steps employers can take is to involve their workforces in these processes. Human resources who feel and are part of change and improvement make very meaningful contributions. In fact, numerous studies of industry in the United States and a variety of European countries show that employee involvement is essential to the ultimate success in managing changes and maintaining the health of a workforce. What I have alluded to is that with changing economic structures, the types of injuries and illnesses will change for working populations. Therefore, it is essential to look at current legislation and ascertain that it reflects how workers will become injured or ill. full utilization of existing government-sponsored training facilities and programs should not only be a goal of government, but business as well. For example, the International Labor Office helped establish the SENAC and SENAI, or the National Training Agencies in Brazil. SENAC training focuses on service industries, while the SENAI activities are concentrated on industry at large. Funded through a payroll tax, Brazil maintains various training sites throughout the country and offers such programs as health professional training. This is an excellent model which is worth duplication. I see educational institutions as an essential bridge in the ultimate recognition and development of control strategies when considering injury and illness trends and in training specialized productivity professionals. One important area of responsibility for these new professionals will be the study of the relationship between the direct and indirect costs of injuries and illnesses. Let's look at this in more detail. When an employee becomes injured or ill, there are both direct and indirect costs. The direct costs are easier to calculate as they usually include medical payments to get the injured or ill employee well, indemnity payments to compensate these individuals for time off work, and increased insurance costs. As these costs are known and can readily be seen, they are reflected as the tip of the iceberg. The indirect costs comprise the rest of the iceberg, in fact, the vast majority of its bulk. These costs, which greatly impact the productivity of all organizations, however, are more difficult to calculate. Generally, the indirect costs are not thought of, but they tend to have a greater impact on an organization's bottom line than do the direct costs. Most references place the relationship of direct to indirect costs at 1 to 4. That is, for every dollar spent to directly compensate an injured worker, $4 are spent on indirect costs, which, by the way, are considered unrecoverable, primarily due to the fact that they are uninsurable. What types of considerations comprise indirect costs? Included in indirect costs are loss of customer goodwill due to unfilled or late orders, issues surrounding quality, lost time of the worker, time lost by employees either assisting an injured worker or just watching, damaged goods and equipment are also included. By controlling incidents, that is to say, injuries and illnesses from occurring in the first place, indirect costs have less of an impact on an organization's productivity. Over 1,000 years ago, Agricola, often referred to as the father of industrial medicine, said, "The past is prologue." Clearly what he was referring to is that the factors which place human resources at risk for injury and illness rarely change. In one example, Agricola suggested that vast pools of labor supplies is a disincentive for employers to undertake safety and health measures. In many countries, including the United States, there is some truth to this. When one worker is ill or injured, out the door they go, and another worker comes in right behind. There are clear disadvantages to allowing this model to perpetuate itself. In some ways, such occurrences may be illegal, but the cost of continuing such a practice can be staggering. This is particularly important if you believe that rapid and continuing change will take place in technology and the demand for specialized employees will increase. It will simply become unfeasible to maintain an out one door and in the next mode of operation. Some of the factors referred to by Agricola still exist in the world today, including child labor and dangerous work practices. The International Labor Office has established standards to confront these issues. In fact, they have offered 5, including outlawing forced labor, permitting the freedom of association, regulating child labor, the right to collective bargaining, and the regulation of dangerous workplace conditions. There are relationships to what has been long-standing ILO considerations to the development of safety and health dynamics in the workplace and maximizing productivity. For example, the dangers of work will change as more and more of the world moves toward a service economy, well, at least a service economy which is a greater portion of a nation's gross domestic product. Service sectors see less acute trauma and more cumulative traumas, such as repetitive motion disorders and psychological stress. I would like to use an ergonomics situation as a model to begin the concluding portion of my remarks as such a model reflects the changes in the world working structure, the types of injuries and illnesses which are likely to develop, and also speaks to methods of controlling the development of injuries and illnesses. The study of ergonomics is essentially the analysis of tasks as they relate to the people conducting them. Formally, the science of the laws of work, the primary factors of risk for adverse ergonomic outcomes are force, posture, and repetition. Other factors enter into the injury development, including environmental consideration, which are often referred to as secondary risk factors. As the world changes how it accomplishes tasks, such as a higher percentage of employees working in a service sector job, the risk factors to ergonomic-related injury are greater. As these injuries develop, productivity is impacted, as these injuries are more costly and often more difficult to resolve. Key workers are out for longer periods of time due to their injuries. The impact on supplying goods and services is heightened. Bringing in temporary workers, perhaps a necessity, nonetheless negatively draws on production capability as their skills are less than the injured worker. Thus, the growth in the hidden cost of injuries and illnesses begins their climb. The corrective action often affiliated with ergonomic risk factors applies to most other exposures to injury and illnesses in the workplace and creates a solid model for controlling economic loss due to such outcomes. Corrective actions come in the forms of physical, administrative or training, and education controls. Of course, wherever possible, it is best to engineer out hazards or modify processes so that one or more of the primary risk factors are significantly impacted. Administrative controls, on the other hand, do not modify the actual factor of exposure, but such controls do reduce exposure time, thus effectively diminishing opportunities for outcomes such as injuries or illnesses. For example, a worker who has to stand all day and sort parts is at high risk of lower back problems due to the static nature of the job and physical forces on the low back. Such exposures can be engineered out by providing equipment to do the sorting or by providing adjustable working apparatus, such as a chair, to exclude the forces of standing for long periods of time. An administrative control would include rotating workers through this sorting operation in order to minimize exposure to injury. In the administrative control strategy, success in maintaining production, reducing injuries, and maintaining the strength of an overall process may be possible, but the exposure to injury still exists. Of course, to make either physical or administrative controls work for you, training and education must be provided. We have concentrated heavily on on-the-job issues. In a vastly changing world, we will all find ourselves thinking of strategies to call on to maintain the productive capabilities of our workforces. One area where such strategic integration will be necessary is the inclusion of off-the-job issues in overall plans for maintaining and improving productivity. Three essential factors to bring into focus are housing, education, and transportation. With few exceptions, such as in some agricultural settings, the existence of company housing in the United States is a thing of the past. It is important, however, to recognize that housing is an essential component to the development of a healthy workforce, one which can be as highly productive as possible. Governments may play the most key role in this consideration. Making suitable housing available is essential, and by being available creates a workforce which is ready to do just that, work. Coupled with access to transportation, housing plays a key role in off-the-job issues which impact productivity of an organization. Transportation, too, is essential, and both governments and employers can provide assistance in this area. By making transportation available to large groups of workers, not only can they get to work, but they have greater access to health care and recreational activities which improve their overall health. We have agreed that healthy workers are more productive. Johnson & Packer and Workforce 2000 hypothesized that occupations of the future will require more education and training. As you can see, they feel that jobs requiring 1 to 3 years of college and more than 4 years of college is going to rise for future new jobs. Employers need to plan for this and work with educational institutions and government. The lack of education in most employment sectors will see continued underemployment, unemployment, and a resultant impact on an organization's ability to survive, much less prosper. Who will handle the safety and health of human resources? We have discussed what factors to concentrate on from a health and safety management perspective and reviewed the likely challenges that lie ahead for governments, business, and employers. But this serves as only a portion of the strategic approach to managing the future welfare of our working populations. The question is, so now what's missing? The answer is that each of the constituents I just mentioned will need someone to lead their program of recognition, evaluation, and control. That is to say, the recognition of the factors which are impacting the health of workforces and productivity, evaluating the magnitude of the problems so as to prioritize time and resources in the response and establishing controls, whether they be physical, administrative, or training and education controls. The professional responsible for determining risk factors and planning strategic approaches must be knowledgeable about prevailing laws and standards, as well as those in the making. This knowledge should transcend local or regional standards, as much of what is occurring globally is worth seeking out. For example, the American National Standards Institute is nearing the end of its development of a standard on the control of upper extremity cumulative trauma disorders. Although not legally enforceable in your country, the technical and practical data in this standard will assist you in your efforts to control many of the ergonomic risk factors which are present in your businesses. The successful individual will also be a communicator. These communication skills must span management and the working ranks, for few organizations today can afford multi-layered management teams when it comes to a safety and health program. What is legal, cost-effective, and otherwise beneficial must be successfully communicated to all working levels in an organization. Technical competency is important, but not as important as knowing when to get technical assistance, for example, in order to maintain the hazards of a job. Being technically competent or bringing in the appropriate individuals assists in developing credibility, which is essential to ensure long-term change. In order to strengthen requests for modifications in processes or in the old way of doing things, the individual responsible for implementing our noted strategies will also be able to show the cost benefits of such changes. Such benefits may be expressed in improved production, sales, a reduction in lost days from injuries and illnesses, the subjective contentment of a workforce, or often in the reduction of expenses, such as for insurance. Lastly, the productivity expert that will help lead our organizations into the future, creating healthy workers and improving productivity, needs to have a good feel for the basics of occupational safety and health, along with the interaction of human resources management. The integration of these two disciplines is both commonplace and practical, especially in small to medium-sized organizations. San Diego State University, in fact, offers a class in safety and health management for human resources professionals within its Human Resources Management Certificate program. Although such specialized training is available through universities and colleges, it can also be found through industry associations and governmental agencies, such as is found with the United States Occupational Health and Safety Administration. Oftentimes, similar training can be found through other business relationships, such as insurance companies and the providers of tools and equipment. I would like to note that in many of these relationships, the fee for training and education is nominal, if not free. As I conclude my remarks, I would like to highlight that two major points exist for consideration, both to manage the health of your workforces and to maximize productivity. The first centers on the element of recognition, while the second contemplates strategies to employ to assist in meeting future goals. There are 5 elements of recognition that came from today's review, including the exposures and risk factors which will impact worker health and productivity, in fact, are changing. There is now more than ever a need to involve human resources in the change process. The indirect costs associated with injuries and illnesses are unrecoverable. Thus, consideration must be given to all forms of control. It will also be important to take a long-range view when making changes in your business, government, or educational environments. And lastly, it is essential to recognize that the realms of change and control must be dealt with simultaneously. Remember, those realms are the physical, mental, along with the environmental, organizational, and social realms. Several strategies are recommended to enhance health and productivity. These include complying with existing regulations and standards, seek the involvement with the standards and regulation development process, internal studies which determine exposures and which of the physical, administrative, and training or education controls are necessary to put into place. Such studies should be done preemptively as opposed to waiting for injury or illness manifestation. Employers and governments should be assisting human resources with the education and management of off-the-job health and safety concerns, improving your listening skills and involving human resources in the change management process, providing training and education at all levels of workers, not just management and above, and assigning the responsibility for the management of safety and health programs to an individual with the ability to do what it takes and who has been indoctrinated to the various facets of recognition and strategies we have discussed today. I appreciate the opportunity to bring some of these thoughts to you today. With all facets of enterprise working together, the health of human resources will not only be managed, but will be improved. By doing so, many benefits will be seen in production and the economic well-being of businesses. Dr. Fuller's presentation will provide more focus on the medical and healthcare models, which are essential to couple with many of the noted strategies for injury and illness control. All are part of the process to maintain and improve productive capabilities. Thank you.
Let's begin the first question and answer session. We'll try to answer as many questions as possible. Therefore, we ask that only one question be asked per phone call and that these questions be as brief as possible. You may call the studio directly at the phone numbers or fax numbers which now appear on your screen. Our first question is a fax from Fenalco, Medellin, Colombia, and it is as follows. Our personnel resources are quite large. If one employee is injured or sick, we can easily replace them. So what is the value to us to create and maintain a safety or health program?
Frank, I'd be happy to take that question. I think it's a great question. Much of what we're trying to get across today is that safety and health programs should be used as not only tools, but an asset to an organization. By training, spending time on training and education, you're investing time and money in your employees. To allow them to leave and not be able to return perhaps is a waste of some of this investment. Secondarily, you will have to retrain new employees and new folks as they come in the door to work for you. So by enhancing the training, by retaining good employees, you're using your asset and your tools to the best advantage.
Thank you. Dr. Fuller, would you like to?
Yes. My experience with the many industries that we deal with is that the more experienced an industry is and the closer they actually monitor their workforce, the more likely they are to adopt a whole series of strategies, which I will talk a little bit about later. But particularly, they will adopt a pre-placement medical examination program to appropriately select people and place them in jobs safely. They will then institute a whole series of preventive programs which are much cheaper than the other processes which would follow. And then finally, they will intervene very early after any injury or illness to save that worker from any long-term disability effects. The result that they find is that it is a much cheaper overall program and that the productivity of the entire workforce goes up.
Thanks very much. We now have a live phone call from Universidad Tecnológica de Tula, Tepeji. Go ahead, please.
Good morning. The question is the following. What techniques do you have to identify the stress factors in an organization that offers services, and especially when you talk about continuous enhancement and continuous quality improvement?
Well, let me see if perhaps I can address two or three elements that are recognition of the factors that relate to stress and perhaps unhealthy outcomes. Certainly things to concentrate on would include turnover absenteeism, or quality-related problems. And by recognizing those outcomes, generally we can shift our safety and health programs and our production-related programs to maximize the utilization of our employees